I want to start with a story tonight that I think deserves a heck of a lot more attention. Is single payer on the table or is it off the table? Healthcare professionals want to know. I want to know. Americans all over the country are asking the same question. Now, earlier this week, and I think this is a travesty, the Senate Finance Committee, chaired by Max Baucus, held a hearing on healthcare reform. All players were there at the table except advocates for single payer. Now, folks, I'm not talking about the Code Pink crowd. I'm talking about doctors, nurses, lawyers, professional people who want and live it and need real reform. Now, the key is they had no seat at the table. The word is excluded, and I want to know why. Insurance companies, HMOs, pharmaceutical companies, hey, they were there.
What kind of democracy is it when you pay to play? When you take millions from your people in the United States and give money to your corporate donors and not provide health care to all? What kind of Senate is this? Is this the Blagojevich Senate? Are you the Blagojevich chairman? We need single payer on the table now.
Now, folks, I'm not a big protester, and I don't advocate going out and getting arrested. But I think this demonstrates the undercurrent in America when educated professional people stand up for their beliefs and are excluded. Now, let me explain single payer for just a minute. The money comes from one source, the government. Now, you and I pay taxes, okay? The government pays the bills. It's that simple. Patients are not caught in the middle between doctors and insurance companies. No game plan here. There's no middleman, you know? There's no decision makers between you and your doctor. It's a clean deal. So what Chairman Baucus has decided, this option cannot be part of the discussion at a Senate hearing. Now, I think that's wrong. I don't think it's fair. I think it's certainly not democracy at work. You know, and I don't care if you're a Republican or a Democrat. These people, these professionals deserve to be heard. Now, we reached out to Senator Baucus's office today for a response, and here's what we got back. Senator Baucus said that he intends to craft a uniquely American solution that builds on the current system and includes both public and private coverage. Single-payer advocates were not, get that, folks, were not invited to testify to the Finance Committee roundtable. But were encouraged to submit a statement for the record. Senator Baucus said at the meeting that he respects everyone's views and wants to work with all the stakeholders to achieve meaningful reform this year. I have to ask the question tonight, President Obama, do you support excluding people from discussion? This certainly doesn't sound like you, Mr. President. There's got to be a disconnect here somewhere between this committee and the White House. And I want to know more. Now, one of the people who was protesting at the hearing, and certainly was a doctor, she's a pediatrician who was educated at Georgetown University, University of Maryland, and Johns Hopkins. Do these professionals deserve not to be heard? Joining me now is Dr. Margaret Flowers. She's with the Physicians for a National Health Program. Dr. Flowers, thanks for being here tonight. You know this is my issue, and obviously it is yours. Tell our audience tonight what happened at this meeting, at this hearing.
Well, thank you, Ed, and thank you for having me on the show. So we knew that this roundtable discussion was coming up, and in days before the roundtable, we had people calling in to Senator Baucus's office asking to include somebody who represented single payer. And on Monday, the day before the event, we heard that the invitations were finished, that we wouldn't be invited. And so we went down there, 8 of us, all health advocates, all knowledgeable about single payer, and we went to the round table, and as it began, one of our members of our group stood up and said, "We're here, we'd like to have a seat at the table. Will you give us a seat at the table?" And he was arrested.
Okay, now I want to be very clear here, Dr. Flowers. Did you communicate with the Senate Finance Committee and tell them that you represent a lot of people and you've got a big organization and you want to be heard? Did you ask to be invited to this?
We did. Yes, and we even had a specific ask, a specific person that we would like to have had included.
And what was the response?
They said there would be no more invitations, that nobody else could have a seat.
Okay, now do you think it was just no more invitations, they didn't have enough room, or do you think they just didn't want to hear from single payer?
No, they don't. They just don't want to hear from single payer. I mean, we've been trying for months now, meeting with members of Congress to be included in the hearings and the events that they're holding, and they keep excluding us from it.
Do you think the majority of Americans want single payer, and can you quote any surveys or any numbers tonight?
Sure. Well, there have been a number of independent polls that have been done by CBS, the New York Times, Yahoo. They all show consistently that over 60% of Americans would like a national health system based on single payer, and the same for physicians. We know that around 60% of physicians nationwide want a national health program.
Okay, now, folks, I want our audience to grab this. The majority of Americans, by a number of polls out there, Americans want single payer, yet the first health care reform meeting that's held by Senator Baucus, the Finance Committee, you're excluded. How many people do you represent? How many in your organization? How many are behind you?
Right. Well, the Physicians for a National Health Program has over 16,000 members nationwide, but we're part of a larger group called the Leadership Conference for Guaranteed Health Care, which represents over 20 million people nationwide.
20 million people, I guess you could say, excluded. Now, the question comes up, now 16,000 healthcare providers, that's really a fraction, but what about healthcare providers in totality in America? Are there any surveys there that say they want single payer?
You know, the last one we had done was 2 years ago, and that was actually using the American Medical Association database, which tends to be a fairly conservative group. And 59% of those physicians surveyed wanted a national health program. If you look at pediatricians and other general primary care providers, it's more in the 70s and up to the 80s.
Okay, now you're a pediatrician, and I understand that you've given up your practice for the last 2 years to advocate for this. Is that correct?
That is correct.
Okay, what's the next step? Are there any more hearings coming up that you know of?
Thank you. Yes, there's another hearing on Tuesday, May 12th, and we would like Senator Baucus to invite Dr. Marcia Angel to be able to speak at that roundtable discussion.
Okay, so you're just asking for one person at the table, correct?
Correct.
Okay, and the insurance industry was there, and the HMOs were there, business interest was there, but let's be clear here, single-payer folks were not allowed, right?
Right. There were 15 people at that table.
Thank you, Dr. Flowers. Keep up the fight. Let me turn now to Michigan Senator Debbie Stabenow, who sits on the Senate Finance Committee and was there that day when these folks were escorted out. Senator, Americans want to know, how did this happen?
Well, Ed, first of all, I want to thank Dr. Flowers for her advocacy and everybody who is speaking out for a single-payer health care system. I'm not familiar with how things were put together that day, but I can tell you that I'm meeting with people who care about this issue passionately, want us to consider and look seriously at a single-payer system, and I know that other members of the Senate are doing that as well. I mean, I want to get insurance company bureaucrats out from the middle between patients and doctors. But I do want to also caution something else, Ed, which is part of what this whole process is about. While folks will say, yes, we want national health insurance, and I want that. I believe health care is a right, not a privilege. But we also have folks that say, I want to be able to keep my health care that I have now. And most people get their health care through their employer.
Okay.
So we're trying to figure out, in my state, a lot of folks get it through their employer and would like to keep it. So we're trying to figure all that out.
All right. Well, Senator, if you've got the majority of Americans that want single payer and they're not included at the first health care reform meeting, there's something wrong with this picture. Not to mention, it doesn't go on record to the American people, these folks who want to testify and say it's actually cheaper if we go down this road. But the pictures we have now are these people being escorted out. Some of them were arrested. What impression does that leave with the American people when stuff like this happens? Oh, here comes the single payer psycho crowd. Wait a second. In fairness,
sure.
Can you get Senator Baucus to change his mind on this and make sure they're included in the next few meetings?
Well, first of all, the situation at Finance, I think everybody felt was extremely unfortunate. I felt very bad about the dynamic about all of that. Absolutely, people need to be involved. There are a lot of presentations, a lot of meetings coming up. And I think what is most important is that we keep focused on the fact that we've got to have a healthcare system where everybody can get health care, where everybody can afford to do it. And if you'll keep pushing, everybody